This video is not intended to be a treatment guide for cancer patients. All patients should make choices with a consultation of their healthcare providers. The choices and outcomes of the people you are about to see are specific to their cases, but much of what they learned and felt is not uncommon for cancer survivors today.
I had never even considered cancer. Never considered that I would even get sick. I was still young, brash, and feeling like I was going to live forever.
I was at the gym, 4 or 5 times a week. I was training for 5Ks. I was running them several times a year. I really felt like I was the picture of health.
Because of my annual checkups, that's how I found out that there was a possibility that I had prostate cancer.
Reed, Libby, and Doug share a story they never thought they'd tell. About a journey they never thought they'd take.
One morning I woke up and took a shower, and as I was showering, I sort of realized my right side of my neck was swollen. Maybe I'd slept on it wrong and pulled a muscle or something of that sort.
Reed is a husband, a father, and a successful businessman who discovered a tumor in his neck that was believed to be benign. At least that's what the doctors thought, until they removed it.
He operated on it and on my neck and took it out, and I woke up with him looking at me saying, "Oh, we've had a surprise. It looks like it was cancer." And so it was a big shock.
Reed developed a tonsillar cancer that was starting to spread. It was caused by the human papillomavirus that was dormant inside him for 15 years. His wife, Meredith, was the first to hear the bad news.
Of course, I had had the movie moment in the parking lot with my mother sobbing that I have 2 children and their father has cancer and what is going to happen.
To get the best cancer care possible, Reed and Meredith researched extensively by talking to and visiting with the top physicians in the nation. They discovered that the local hospitals had an excellent reputation as cancer care centers, so they stayed in Savannah. Reed used both hospitals, receiving radiation therapy at the Anderson Cancer Institute at Memorial University Medical Center, and his chemotherapy was provided by the Lewis Cancer and Research Pavilion at St. Joseph's Candler.
The treatment that we recommended was a combination of very aggressive chemotherapy and very aggressive radiation. If you really want to maximize your potential for coming out of this cured, then you have to add the treatments together.
Radiation probably would have handled it, but I was young, I could handle chemotherapy, my kids were young, it was imperative that I survive.
The decision to combine the therapies was a bold move that would eventually cure Reed of cancer. But it would not come without a price. The weeks ahead would be some of the darkest weeks of his life.
Obviously, he didn't pay much attention to you, nor did Vice President Hubert Humphrey. Do you feel now?
For those of you who don't know who I am, I'm Doug Weathers. I worked at WTOC and in the news business for 47.5 years.
Doug is a family man and a retired news reporter who is famous in the local area. His TV ratings dominated the competition for a generation. Despite his long-standing popularity, cancer makes no exceptions.
Once they say the big C word, you automatically think, oh my gosh, I'm going to die. But then you start thinking about it. They've come a long way in treating cancer this day and time. So I don't think that dying at this moment is in the equation. I think that living is in the equation.
Because he had a physical exam every year, his doctors were able to catch it while it was still treatable. He had his prostate removed with the aid of a robotic device that enabled him to get back on his feet in no time.
Well, Doug Weathers, as I said, is an ideal person to deal with because he follows instructions. He exercises a lot. He takes care of himself. He looks quite healthy, and so he's willing to do anything to improve his life.
Doug's cancer went into remission, but his doctors continued to monitor his health with frequent checkups.
Part of my job is giving bad news, unfortunately, and it's so different being on the other side of that phone call, of getting bad news.
Libby is a wife, a mother, and a genetic counselor who was at work when she first learned that something was wrong with her health. She would later be diagnosed with cervical cancer.
I remember Getting off the phone with the doctor and walking next door to my coworker's office, I really just was overwhelmed. And I was very lucky that I had amazing coworkers that were there to support me, because you literally feel like your whole world's falling apart.
Fortunately, her cancer was discovered early enough to be treated.
Getting regular screening is extremely important. We have a very good screening test for cervical cancer. It's called the Pap smear. The reason her cancer was detected early is because she did get screened on a regular basis.
Although the cancer was not advanced, it infected her reproductive organs enough to require a radical hysterectomy. At the age of 33, she would not be able to have any more children. To make matters worse, her mother was diagnosed with ovarian cancer only a few weeks earlier. Now, Libby was faced with a task of telling her parents that she had cancer too.
Well, I showed up at their house unexpected. And the hardest part was they thought that I was pregnant. So they thought I was coming to give them good news. And they got excited because I had a daughter, but that was it. And they had always kind of been teasing me about having more children, and they wanted more grandchildren. And it hit me like a rock in the gut. I mean, it just felt like a kick in the gut that they thought that I was coming to tell them I'm pregnant. And meanwhile, I'm coming to tell them that I have cancer and that I would never be able to have children anymore. It was horrible. And they sat there in shock. We all cried. It was devastating.
The entire family had to rally around their two cancer survivors as Libby prepared for surgery. Meanwhile, Reed embarked on a full treatment schedule every weekday for 7 weeks. The responsibilities of his job took a back seat as he traded business suits for patient gowns. These images were taken by his wife, who was always by his side.
You know, they didn't ease you into anything. You know, day one, I walked in, it was about 30 or 45 minutes with the radiation, and then they shuttled you over to Lewis Cancer Center and sat in a chair for 7 hours and did chemotherapy, all in the same day. You're in a room with 9 other people, and you're all sitting in these loungers for 8 hours with pretty brutal chemicals being pumped into your veins. Some people are even more sensitive than I was and are throwing up, you know, into trash cans right next to you. Some people are terminal cancer patients who are receiving treatment right next to you. It's a difficult experience to grasp because mortality is so apparent and so real.
The biggest misconception about chemotherapy is everybody gets sick. But the medicines today that go with chemotherapy kind of help prevent this as best we can. I'm not going to say that all patients are going to feel fine on chemotherapy and work, but many patients are surprised at how few side effects they have from chemotherapy over what they expect.
Unfortunately for Reed, he was one of the patients who did experience negative side effects. He became extremely tired, highly nauseous, and food had a poisonous taste. To complicate matters further, the radiation sessions were beginning to take a toll on his body.
You're treating a 2-inch area in the back of the throat, and you're creating a second-degree burn. So it's just like a huge blister on the back of the throat, and it's very painful.
It's a brutal experience, and you combine that with nausea, and it's a very challenging result.
He couldn't swallow, he couldn't eat. And I had learned from day one, pre-treatment, the most important thing was for him to eat.
The task of getting him to eat became a constant challenge as physical and emotional realities reached a climax in their home.
Hey, Dr. Torres, how are you? Good, thank you. How was your holiday?
Pretty good. I went home and had a wonderful...
Doug thought he was clear from cancer, but Dr. Torres continued to monitor his PSA levels, and a year later, those levels started to rise. This told them a few cancer cells were still present, so he underwent radiation treatment from Dr. Dutton Haver, who happened to be an old golfing buddy.
They gave me 38 treatments of radiation. Treatment was very simple. It lasted only about 5-10 minutes, and the treatment was over. But it was just a routine of going.
His radiation treatment was successful, and his last recorded PSA was 0.02.
Literally a week or two after he finished treatment, we went out and played 18 holes of golf together. And I think I may have beaten him, but he may remember that differently.
There it is. All right.
There it is. I pulled it, but it's going to be all right. It's okay.
Doug says his radiation treatments were virtually painless with few discomforts. This is due to the fact that the tissue in the prostate area is not as sensitive to radiation as tissue in the throat area, which is where Reed was receiving treatment.
During my years as a reporter and an anchorman at WTOC, I did a lot of stories on people, famous people, who had cancer. And I have done some really, really horrible stories on people who did not try to take care of themselves and people who tried, and there's a definite difference.
If you don't get screened often enough or early enough, that you could have already advanced cancer. I've been in practice for about 40 years, so I've seen all types of patients. I've seen patients die from this disease, and they die a miserable death too, because it goes to their bones, it hurts.
Any man can have their prostate cancer detected early with a PSA test. We just need the guys to come in and get their annual PSA test.
Libby's family finally experienced some good news. Her hysterectomy successfully removed all the cancer, and there was no need for chemotherapy or radiation. She was back at work in only 4 weeks. With a new lease on life, she was determined to make a difference.
And there was something about my mother and I both being diagnosed within this 2-month time frame that I really felt like God was just telling me, you know what, you've always been outspoken, and here's you a new cause to talk about. So I started an organization called Help the Hoo-Ha's. So we're raising money for women locally that are battling GYN cancers, providing support and resources, whether it's money for gas and grocery gift cards, something to make their lives a little bit easier. We have a 5K run in Savannah every year, and this past year we had over 300 people there walking and running, and really raising awareness for these types of cancers.
Libby's cervical cancer and Reed's tonsillar cancer were caused by the human papillomavirus, or HPV. This is a sexually transmitted virus that lives undetected in most people today. It can remain dormant for years before causing cancer. But there is a vaccine that can prevent people who are not sexually active from contracting the virus.
But I can promise you my daughter will have that vaccine, because if there's anything that I can do to keep her from having cancer, without question, I would absolutely get that vaccine for her. It can dramatically lower your risk for cancer.
While some cancer survivors move on after a relatively brief interruption of their lives, others travel a harder road. Reed's bedroom began to resemble a hospital room outfitted with medical equipment. Meredith shot this demonstration to learn how to perform certain processes. Caring for her husband became a full-time job.
Toward the end, I could only take in maybe 300 or 400 calories a day, and my body started atrophying, my legs started atrophying, and I lost just a tremendous amount of weight.
He wasn't going to chicken out and not take the therapy, but it was really Meredith that was pushing him, and when Reed didn't want to eat and drink because it hurt to swallow and it tasted lousy, she was standing there with her milkshake and saying, you got to do this. For me, for the kids, for you, you got to do it.
So we didn't always see eye to eye, and sometimes he didn't want to do what I asked, and sometimes I didn't want to ask him to do what was needed. But we just continued and moved forward, and there were times when he didn't want to drink a thing. He couldn't swallow. It hurt so bad he couldn't talk. He would say to me in our notepad we kept by the bed, where he would write in large angry letters and point at the paper, "It hurts too much, I need help, I cannot drink." And I would tell him yet again, we've given you all the medicine you can have, I'm so sorry, you have to drink. I may cry, but that was not in front of Reed. I cried often, but that was not in front of Reed. I would recommend to anyone who is a caregiver for a patient going through cancer that they find their own support system. I called on friends, I laughed with them, I cried with them, and it was often downstairs in our kitchen because I couldn't leave our house in case I was needed.
I can honestly say that in 35 years, I can count on just a couple of fingers the spouses that have stepped up the way that Meredith did. She became Reed's life coach, his nutritional support. It was really a sweet thing to see.
And he continues to this day to tell people I saved his life. What a nice thing to hear and to feel that someone feels that way about you.
Reed endured the pain until the day the last treatment arrived.
Okay, you coming back? It's the last one.
Reed! You can smile. I know you feel like crap.
I remember that 33rd day very clearly, and going into that treatment, coming out, and I pulled the crew together that took care of me, and I sort of did a huddle, you know, and thanked them for taking such wonderful good care of me. And
we get attached to each other, patients to doctors and therapists and vice versa.
So it was just a lot going on the last day of treatment especially. It's very emotional. And of course, the therapists, we get attached to our patients. We love our patients.
Oh, sweetheart.
He was tough, and he just kept trucking through it, and he did great.
I chose to do everything I possibly could for my family. I committed to do whatever it took to be here for them.
It would take 4 weeks longer for him to recover.
The love and support of so many was amazingly touching. And I still have all the letters.
You know, I feel very lucky because we are 1 year post-treatment. We go on short vacations with the children and walk to the park and go out in the boat and do the normal things we did before.
Today, he's healthy and working again, but with a deeper appreciation for life. He counsels other survivors over the phone, in person, and he's become politically active. He spoke to the President's Cancer Council to raise awareness about the human papillomavirus. Libby's mother was in remission for 2 years, but her cancer recently returned. She is currently going through chemotherapy again.
Everybody has this journey that's called cancer, and everybody's journey is a little bit different.
This disease does not spare personalities. He was not immune to the disease. He still had a disease. So it's important that you be screened.
You don't want to keep putting off going to the doctor, putting off going to people who can determine whether or not there is a possibility that you've got a problem.
I think cancer survivors, my experience, they are such remarkable people.
I felt like I had gotten slapped down by cancer, and by doggone, I was going to get up and fight back.
It changes your thought process. You kind of want to live every day to the fullest.
Cancer to me brought life to the forefront. It's an amazing experience.